Hello and welcome to another program on COVID-19, the good, bad, and the ugly. Today, I'm going to go a little bit into the scientific aspect of the COVID-19, and to talk about that, no one more better than the country representative of WHO, and that's my guest today. And she is Dr. Razia Pense, the WHO representative to Sri Lanka. Dr. Razia, thank you very much for joining this interview in spite of your very busy schedule these days. Can you start on by telling us what exactly is this COVID-19 or we commonly know as coronavirus?
So coronavirus disease, COVID-19, as it is called, is caused by coronaviruses. Coronavirus as a family is known to us for some time, but this particular virus, the COVID-19, is a new coronavirus. Initially, it was called the novel coronavirus. Later, WHO called it as the COVID-19. It stands for coronavirus disease. 19 is the year in which it was reported to WHO. The other diseases caused by coronaviruses, which are well known, are SARS and MERS coronavirus disease. Generally, these viruses, they are the reservoirs are animals, and time to time they make a jump from animals to humans and cause disease. So they are called zoonotic diseases. For SARS and MERS, we know who the animal host was, but for the novel coronavirus or the COVID-19, we do not as yet know the intermediary animal host. The primary reservoirs are generally known to be bats. Now, this is a respiratory disease, and by that what we mean is that it causes respiratory system disease. The symptoms are general like any other respiratory disease: fever, cough, or difficulty in breathing. In the COVID-19, what we know is that fever is the most common symptom, and what is there is a dry cough. Generally, upper respiratory infections, which is sniffles and runny nose, which is more common with the flu, the common influenza, is not so common with the coronavirus disease or the COVID-19. And if you have these now, because this disease started in China and now, of course, it's there all over the globe. Initially, we said that if you have these symptoms and have a travel history to a country having this disease, then we were having a suspected COVID-19. But now, because it's there everywhere, so anybody with these symptoms with a contact with a COVID-19 case or coming from having a history of international travel is considered to be a suspected case. Generally, if you have mild symptoms, what we say is you stay at home and use a mask so that you do not transfer the disease to others. If you have difficulty in breathing, you should be contacting your health worker, give all the history so that then they will make a determination whether you fit in the definition of COVID-19, and then they will tell you what next course of action would be.
Okay, now, in listening to you, I found that it is originating from a bat, if I may say so.
Okay.
So far, has it been found, how did it transfer from an animal like that to a human? Has scientific evidence been found to that extent?
No, we do not as yet know who the intermediary animal is. And while this virus is there in the bat, it does not cause disease in the bat. This is important to have to know.
Right. Okay. Now, as a country, we know you all have helped us, and our health system, the government, everybody together has done a lot, and we have taken precautions, and we're doing a lot to cure the people and everything. But presently, as of today, where do we stand? Are we standing at a better footing than 2-3 weeks ago, or are we still yet to peak? Or what is the assessment of WHO on this for Sri Lanka?
So as of today, the number of cases reported by the epidemiology units is 180. These are confirmed cases of COVID-19 in Sri Lanka. Now, if we look at the history of the disease that it has taken, the epidemiology of this disease in Sri Lanka, the first case was reported on 27th of January. And after that, we didn't have a case until 10th of March. And after 10th of March, we have had cases being reported. Now, in the COVID-19, and people would have heard a lot about flatten the curve or keep the curve flat, is about having the number of cases limited to reasonable numbers that the health system can cope. So if you look at the numbers of cases reported, the highest ever reported in a day was 21. Now, this is not a huge number as we look at other countries who are reporting number of cases, because there's upwards of 3,000 or more cases per day being reported, many countries reporting 1,000 and more. So Sri Lanka is in a much better position vis-a-vis many other countries in the world in terms of the numbers being reported and the interventions that the country has taken in order to prevent further transmission of the disease. So all in all, Sri Lanka is in a much better situation than many other countries.
Um, Precautions and what we have to do to minimize this and tail this off. What are the WHO guidelines for public like us, and what are the guidelines for the authorities?
So this is a respiratory disease. It is caused by a droplet infection. Now, when we cause it a droplet, means these are those tiny, wet particles that come out when you are speaking and when you are coughing and sneezing. Now, the particles that generally carry for COVID-19, they are between 5 to 10 microns, and that's why we call it a droplet infection. These droplets stay in the air for some time and then they settle on surfaces. And that's when you touch these surfaces, or when they are there on your, especially the face, because it's a respiratory infection. Through that, the virus enters your body. So in order to have personal protection, that's why what WHO says is wash your hands. Because if you wash your hands with soap and water, the virus is killed, because its capsule degenerates and the virus gets killed immediately. If you do not have soap and water, you can use an alcohol rub, and the alcohol content should be over 60%. The other thing is having respiratory etiquette, because when we are sneezing and coughing, these come out with a force. And that's why these droplets, they then travel, but because their size is big, they won't travel for more than 2 meters. It's maximum that they can travel. And that's why we say cover your cough and sneeze, so that these you do not spray your surrounding with your droplets. And the other thing is having physical distancing. 1 to 2 meters is what we say, because these droplets would not carry themselves more than 2 meters, so you will not be infecting others. So if we take these personal protection measures and the physical distancing, we will be protecting ourselves from catching this virus. The other part of the response is, so this is a defense, and what we need is we need to have an aggressive attack on the virus.
Yeah.
For that is more a health systems thing. We need to test people, treat them, isolate those who are infected, do the contact tracing of their close contacts, and quarantine them. This will help us contain the transmission and not only keep the curve flat, but also bend it and end the disease in future.
What is the story behind testing? 3 times testing is necessary, or it's just a phrase?
I think so. It's just a phrase. And when it was quoted, it said that, when somebody says test, is not to do a test 1, test 2, test 3. It is that we need to be more aggressive about our testing. The more people we test, we will be able to identify those who are positive, because if we identify the positives and isolate them, their contact with others is reduced, and so we will not be transmitting the infection, because the droplet infection happens between close contacts. So test means to do more testing. It doesn't mean test 1, 2, test 2, and test 3.
Right now, if a person is quarantined, or a group is quarantined, at the time of going into quarantine, it's a test taken and they're put quarantine, or is it or you do only the test after the 14-day period in quarantine is over?
So there are 2 terminology which is used. One is quarantine and one is isolation. You quarantine people who are coming from areas where this infection is happening, or who are casual contacts of people having the COVID-19 disease. So people in quarantine are not suspected cases of COVID-19, but they have had exposure. So you put them in quarantine, because 14 days incubation period where people will start to show symptoms of the disease. Once you show symptoms, then you are immediately tested. Now, so while you are in quarantine, you are not having disease, but you have the potential to have the disease. So you're kept in quarantine If you show symptoms, you'll be tested and taken for treatment. If you do not show any symptoms, then you are clear that you do not have the disease and you'll be sent home. But when you isolate, that is when the person is having a positive diagnosis, and then you immediately isolate the patient so as not to have any contact with other healthy person.
Right. So a person now, we know several people got cured in Sri Lanka as well. And once you get it and when you get cured, are you more susceptible to getting it because your system is weak or something, or are you back to 100% normal as you were before?
As I'd said before, that the COVID-19 is a new virus, and we are learning about this virus every day.
All right.
The evidence till date, we do not have any robust data to say that people who have once have had COVID-19 have been reinfected. Also, we have to realize the first time the disease was reported was 31st of December. We are in beginning of April, and today happens to be World Health Day. So it's like, 12, 13 weeks that we are into the epidemic. So it's too early to say how long the immunity lasts, how susceptible the person who has already had this infection is to reinfection or subsequent infections with COVID-19.
So happy World Health Day for you and everybody, all the health sector people in WHO and every institution. You're doing a great service. My other question is, now we all are in lockdown situations all over the world. We are in lockdown situations in Sri Lanka, especially in the Western province and other provinces as well. We all like to see a possibility of a day that this ends. Is there any forecast from WHO to say that country by country, Sri Lanka, probably this day you could be better? Is it possible to forecast like that, or is that a forecast?
I don't think, we can do a forecast that, okay, after 14 days you can open up, or after 21 days you open up.
Right.
When a country goes into a lockdown, this is basically to ensure that there's physical distancing and that there is no transmission happening, because as I said, people have to be close together to have this transmission. To break the chain of transmission, you have these lockdowns. But this lockdown is by itself is not going to end the disease. Because this buys you time to do the testing, to prepare your health systems if there are more cases identified. So you have to have both the approaches. So you do the lockdowns, you use that time to identify cases, to manage those cases, to isolate them, to trace their contacts, to put them in quarantine. So once this all has been done, then the ministries of health with other senior officials that can make a determination that we have been able to do the contact tracing of all possible, say, contacts. And so we feel that there will not be too much of transmission, because what Sri Lanka is currently trying to avoid is a community transmission, where you can have transmission happening anywhere. Because currently we are having a cluster where there are all known contacts. You can trace who this person would have gotten the infection from. So we want to prevent that community transmission. So this lockdowns buys us time, but we can say that it's a 14-day. So after 14 days, you can open up, or after 21 days, you can open up. How you manage both the defense against the virus and the attack on the virus, that will determine how long the lockdowns will last.
Is that a particular
And would you need a repeat lockdown? Sorry.
You need a what? Sorry, I interrupted you. You need a repeat.
No, I was saying that, it could be that, if you release these lockdowns and then suddenly if there's more cases, then there'll be a lockdown again.
Again, yes.
So it's not, there is a science to the lockdowns. It's not just done because people need to be put into their homes. There's a reason and a rationale behind it.
Right.
Over to you.
Right. So, is there any particular theme on the World Health Day this year? Were you planning for a different theme? WHO?
So our theme for the World Health Day continues to be universal health coverage, but this is the year of the nurse and the midwife. Mm-hmm. And we really want to salute our frontline functionaries, especially the nurses and the midwife. Without them, we would not be having any health systems, and especially in the COVID-19 response, I think so our healthcare workers deserve our applause, our appreciation, and what they are doing for us. It is, I don't think so there are any words to express that.
Exactly.
And that's why when we say, when people stay at home, they can do their work well. And that's why also for the personal protective equipment, they need the protection far more than anybody else. And we should ensure that they are safe when they are delivering the services to those who need the most. So this year is the year of the nurse and the midwife, and our salute to the frontline functionaries and all the healthcare workers who are involved, especially in this COVID-19 response.
So as public, we also share the same sentiments. We are eternally indebted and grateful for them. But to come back to our safety measures, which you should be following, we wash our hands 20 seconds with soap and water or alcohol rub. We uh, take continue to do social distancing and stay at home and follow the WHO and health authorities guidelines. Wearing a mask, there is a question: is it necessary? I have heard different schools of thought. What is the WHO view on wearing a mask?
So the WHO guidance as of now, based on all available evidence, is that uh, healthy people in community settings do not need the mask. Mask is for protection for others and not for personal protection. Because if you're sick, you need to wear a mask. If you're caring for the sick, you need to wear a mask. Um, but there is also this about, there's medical surgical masks and there are cloth masks. And so there are many countries who have given guidance to the public that they can wear cloth masks and reserve the medical surgical masks for health workers. Now, WHO is saying, fine, the countries can make a decision and people can wear these masks. What is most important is that mask alone will not provide you with the protection. It has to be with hand washing, respiratory etiquette, do not touch your face, and physical distancing. Generally, what happens when people wear a mask, there's a false sense of security and they don't do the other measures like hand washing, which is most important. So from WHO perspective, masks are needed absolutely by health workers. In any setting, they need the medical surgical mask or the respirator mask if they are working in highly infectious settings. For community settings, if you're sick, wear a mask. If you're catering for the sick, wear a mask. Or if you are in conditions where physical distancing is not possible, where it's a lot of overcrowding, so you can wear a cloth mask. It's just a mechanical protection. But remember to wash your hands, have the respiratory etiquette, don't touch your face, and to the extent possible, have physical distancing.
Right. What would you have, Sri Lankan public, anything that you see we are still not doing? What is that? And also, what else would you have our health system do more? Or are you happy with everything that's happening here?
I think so. There is always, we can always do better.
Yeah.
Even when we are doing our best, there's always a scope for improvement and for this disease, which is new and we are learning every day. To the public, my appeal would be that what we need in this epidemic response is solidarity. Stigma and discrimination has no place. And please get information from the right sources. What is happening in this pandemic is misinformation. So the infodemic, as we call, get the right information, propagate the right information. That will empower you to take the right decisions for yourselves, for your loved ones, for the community, and for the country at large. Do not discriminate. People with the disease, they are not to be discriminated. Please don't have stigma and discrimination. This disease can affect anyone. And 80% of the people who have this disease are mild. They recover. There are few people who would require a higher level of health facilities like intensive care, 5% may require ventilation, and 1 to 2% may unfortunately lose their lives to the disease. So have the solidarity and physical distancing. If you're asked to stay at home, please stay at home, because if you get sick, then we are burdening the health systems, which are already getting stretched with this epidemic. For the health systems, I think so, what they are doing is, commendable. They are doing all they can, and I think so also for the public and others is that we have to provide all the support to the health system and ensure the government. It's absolutely imperative that our health workers get the protection they need and that we have all the facilities in terms of testing and management and take all the measures we can to contain the epidemic so that we not only keep our epidemic curve flat, but we are also able to bend the curve. Sri Lanka has a fantastic health system and a history of excellent success with infectious disease control. If there's one country in the world that can manage this epidemic and bend the curve, it is Sri Lanka. And together we can.
Dr. Razia Pense, WHO representative to Sri Lanka, thank you very much for joining us with the forensic analysis and the tremendous information you have given us in such short time, and it's really valuable. And thank you for your assessment and your advice. We wish you all the best in this fight against this COVID-19 pandemic, and we'll talk to you some other time soon. Thank you for joining us.
Thank you very much. Thank you.